Get started now. Our first presenter is Muhammed Furkan Cinisli. Do you have your presentation or that you would like to share your screen? Okay, great. So the presentation is by Muhammed Furkan, who graduated with a double major degree from Islamic Studies and Psychology in Turkey. He later got his master's degree in exegesis or tafsir tafsir. He's currently studying at Ibn Khaldun University in the clinical psychology program. Go ahead and get started whenever you're ready.
Thank you so much. أعوذ بالله من الشيطان الرجيم بسم الله الرحمن الرحيم الحمد لله رب العالمين والصلاة والسلام على رسولنا محمد وعلى آله وصحبه أجمعين رب اشرح لي صدري ويسر لي أمري واحلل عقدة من لساني يفقهوا قولي رب زدني علما وفهما وألهمني بالصالحين. Today I'm going to talk about exploring the contributions of Islamic thought to psychotherapy, a thematic analysis of Islamically integrated psychotherapy practitioners. About the content, first I will talk about the research, the content of the research, and then the relevance of the Muslim population, relevance to mental health, clinical implications, and then conclusion. This research began to find some answers to 4 basic questions, actually, and these questions is very important for us. What Islamic practices and thoughts can help the mental health of the clients, and the second one is how Muslim psychologists can add Islamic thought to their therapy practice, and the third one, what interventions and practices that Muslim psychologists use while performing therapy provide more benefits for clients, and fourth one, what opportunities does the connection between psychotherapy and Islamic thought provide now and the near future? In the modern period, there are many therapists who use Islamic thought and therapy practices together, and these therapists offer an alternative way for Muslim clients. Some of them use their own methods, others combine some of the methods, modern therapy techniques, with the Muslim concepts to create a mixed model. The basic question is which techniques are useful for clients. In this context, the most basic resource that can be consulted is the therapist's own experiences. The study centered on the therapist's own experiences and found that certain themes were more dominant as a result of in-depth interviews with them. And about the research, since it's qualitative study, I would like to talk about the features of the qualitative study. Qualitative research design is aimed at understanding a certain role, experience, interaction, situation, or group of people. It is basically to explore the experience of participants. So in this case, it is integration of Islam and psychology by Muslim therapists into their therapeutic approaches with Muslim clients. This type of research approach allows the perspectives, meanings, and views of those interviewed to come to light as they allow researchers to enter their world. It is also allows for the researcher to take the role of the learner and not the expert. Qualitative research requires the selection of participants is purposeful. This is required because only those selected can offer insight into the experience. Therefore, proposal sampling was conducted for this study with some of the inclusion criteria. First criteria for our research is having Islamically integrated psychology or psychotherapy training, having at least a coursework or certificate, or theological study as defined by formal coursework in the foundations of the Islamic tradition. And the second criteria is having at least 1 year of field experience utilizing Islamic orientation in a clinical mental health setting. The aim for creating such a sample was to reach people sharing similar experiences of certain situation or a phenomenon. 8 participants were recruited from different countries. Thematic analysis was applied and 5 themes and 23 sub-themes were identified. I would like to talk very briefly about the stages of the thematic analysis. Thematic analysis is a 6-step research process. After collecting data, the first step is familiarizing with data, focuses on reading and rereading the data, and notes down initial ideas. Second step, generating initial codes, reducing the data and the production of initial codes. Third step is searching for themes, collates codes into potential themes, gathers all data relevant to each potential theme. Fourth one, reviewing themes, checks if the themes work in relation to coded extracts, an entire data set. Fifth one is defining and naming themes, ongoing analysis to refine the specifics of each theme and the overall story. Final step is the producing the report and the final opportunity for analysis. Okay. These are the 5 themes that come out of our study. Although I would like to talk about all of them, I will only mention 3 of them due to time limitation. I think these 3 are more important in the context of this conference. And these themes are integration of Islamic thought with psychotherapy, benefits of applying Islamic thought to the therapy setting, and future contributions of transferring Islamic thought to the therapy. So, the Muslim population can experience many different mental distress and solve them with their own unique methods based on their beliefs. Given that the Muslim population is the fastest growing religion in the world, it is not possible to ignore this knowledge accumulation, which has been ignored for a long time and seen as unnecessary and inappropriate within the framework of modern thought. According to the therapists who want to bridge Islamic thought and the therapy environment, Muslim clients adopt more appropriate methods and respond faster to these methods. In this context, individuals who define themselves as Muslim also associated their mental health problems with this area and wanted the treatment they would receive to be directed toward this area. Many of researchers support the need for Muslims have therapeutic resources compatible with their beliefs and religious practices. On the other hand, one of the results of this study was that the methods applied were not only valid for Muslims, but also for non-Muslims. The therapists participating in the study said that they used their practices and concepts in different ways of non-Muslim clients and received positive feedback. Whether they are Muslim or not, some of the applied techniques seem to be suitable for human nature. This creates a beneficial results in terms of treatment. In this context, one of the therapists said that in my clinical experience, I have found that seeking of spirituality is universal. I can use a similar framework in the context of a person's beliefs and values, although I don't always use the expression of God. I don't have to use terms like dhikr or prayer or dua, but I can bring similar teachings into the therapy room. So far I have received positive feedback from many non-Muslim clients. Especially in the context of the first theme, it was seen that the following integration was applied and good feedback was received. The main technique that used by all participants is to share the verses of the Quran with the client and talk about the meanings of the verses. This is very common among Muslim therapists, and they say that they see the effect of it all the time. This can be talking about a verse or discussing a group of verses together. By establishing a connection between the explanation of the verses and the problems of the client, it is focused on how this means for Muslims. One of them said, when the Quran is read correctly, it has a guiding side for many problems. Although my client heard it many times, I saw that there were verses in his context that they listened as if they had heard it for the first time. Sometimes one cannot see that the verse show a clear way for them. Talking about this during the therapy and pointing out their guiding side gives them a new perspective. The emergence of theme actually tells us something important. It is clinically meaningful that the Quran is not only a text, but also a source of existence and knowledge. In other words, Muslims see what the Quran says as reliable in terms of knowledge, and beyond that, they easily internalize that they should also follow these teachings. From this point of view, the importance of the Quran and education become more important in terms of being a protective factor. And the second one is practical use of the dhikr or dua. Participants mentioned that it has a preventive and therapeutic effect for clients. Dua is common Islamic practice, and many Muslims learn to utilize specific duas that are taught in Quran and Sunnah. And one of the participants said for this issue, sometimes after a thought emerging in therapy, it can easily disappear. and the client can easily return to his old thoughts and feelings. But when we turn into a prayer or dhikr or dua, it can feel the same effect afterwards as we say it. And this is quite effective. The third one is, I want to draw attention to the love of God. This was an issue pointed out by 5 participants. The fact that the client realized that God loves him or her and thinks that he or she he is merciful is a factor that increases his resistance considerably. One of the participants said that every road leads to the love of God. This is like a medical drug, or this is like a medication. Despite everything, God loves us, and clients often forget this and turn to the other loves. When he realizes and internalizes this, treatment becomes easier. These 3 examples are the most common sub-themes. When we look at these more carefully, we can conclude that they actually point to the theoretical, practical, and spiritual aspects of the Islamic thought. The interventions made through the Quran are aimed at establishing the relationships of person with the words of Allah and explain the ontological background of Muslims. Muslims should act on revelation and reflect it in his life. Secondly, dhikr and dua can be seen as the characteristics of religion that cares about practice as well as theory. Thus, the Muslims are not just left to believe, as it mentioned in the verse, Estaizu billah, أَحَسِبَ النَّاسُ أَن يُتْرَكُوا أَن يَقُولُوا آمَنَّا وَهُمْ لَا يُفْتَنُونَ. Do men think that they will be left alone on saying we believe and that they will not be tested? Muslims encounter some examinations and applies to prayers to overcome them. Finally, there is a spiritual and heartfelt aspect of Islam. In this respect, it appeals to the soul of the man, and this reaches the top in the love of Allah. These 3 sub-themes are actually in a position to explain the human imagination of Islam. At the conclusion part, this study carried out within a framework of therapist experiences revealed how Islamic thought and therapy methods, especially Muslim clients, can be considered together. And 5 themes and 23 sub-themes emerged, and these areas were open for discussion. Future studies in this area can be found in more precious determination by making use of the work done so far. And thank you so much for listening.
Okay, thank you for that presentation. We'll save Q&A and discussion until the end, so we can go ahead and move to the next presentation, which is understanding the collaboration between Islamic healing and mental health professionals in Indonesia. With Diana Setiyawati, Wulan Nur Jatmika, Ade Prastyani, and Erminia Colucci. I'm sorry if I pronounced anyone's name wrong. Does somebody from that group want to share their screen?
Diana, can you unmute and start?
Okay.
Okay. Okay. Can you see my screen? Yes.
Yes.
Okay. 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 Yeah. Okay. Thank you very much. Hang on, because I can't see the screen from here. So maybe I need to do something. Okay. 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 Assalamualaikum warahmatullahi wabarakatuh. Good afternoon. I mean like good morning for you in the US. So today we will present about understanding the collaboration between Islamic healer and mental health professional in Indonesia, visual method research. This is a small finding, like I mean part of the big research that from the Together Mental Health Indonesia, Ghana, Indonesia, UK joint initiative. So I will talk about the mental health care in Indonesia. We are still facing some issues about caring people with mental illness due to the situation of the very big countries, and then the situation of health system, something like that. And also because we have a big number of people, approximately 450,000 people live with severe mental illness, and 14.3% experience pasung, or one form or another in their lifetime. Pasung is kind of this one, yeah. This example is example of pasung, which is still our problem in the especially in the rural area, and even worse in the condition of the pandemic, yeah, because maybe people afraid that they will wander around without health protocol, something like that. So then they do the repasung or increasingly doing this kind of care in their home. And yeah, so Together for Mental Health is an initiative that a research, this one, the collaboration between Middlesex University, King's College London, Universitas Gadjah Mada, my university, and then the university in Ghana, and all of this support organization funded by UKRI, Economic and Social Research Council. Indonesia is very diverse, yeah. So we hope we can capture from this research pretty much everything, right? But because of the we have a very huge country, so we only doing it here. In we are trying to capture Islam in Java, and then Hinduism in Bali, and Roman Catholicism in Nusa Tenggara, East Nusa Tenggara. And we also do, this research is mainly using the ethnographic or visual research methods, yeah, with ethnographic approach.
Sister Diana, you're still on the first slide. I don't know if you're trying to change the slide.
Really?
Yes, just to.
Yeah. I am doing the how to do it, yeah.
We only see, we're still on the first slide right now.
Okay.
I think
you have the editing at the top.
Yes.
Enable
at the top.
editing.
Yeah.
Hang
on. Yeah.
No. I think she's. I think you're sharing the like one part of the screen, but we don't see that part of the screen.
Really?
Yeah, I think if you press the slideshow option at the bottom, I think that.
How about now? No. How about now?
No, well, you stopped sharing the screen now.
Now? Is it still?
No, like you stopped sharing screen altogether. We don't see your screen at all now.
Okay, hang on. Application window. How about now?
Yeah, we can see your screen.
And then I will do again the.
I would say don't even do slideshow. Just change it manually.
Okay.
Yeah, just change it manually, just like that.
How about now? It is.
Yes.
You can see.
We can see it. Yes, we can see it.
Okay. Yeah. So yeah. So this is Indonesia. Yeah, I drew it again, and this is the pasung that happened in COVID pandemic, increasing, and this is the our collaborator, and we are trying to do to capturing everything here in Java Island, Bali, and East Nusa Tenggara. And then we are, and the first case study is from Cianjur. Yeah, so Cianjur is the West Java Island, and this man Nur Hamid run the facilitate the care, residential care for people living with mental illness. So we are trying from this research, trying to understand how potential all the stakeholder in the field can collaborate with mental health professional to prevent the violation of human rights, like what has happened, like in that I showed before, the pasung and related stuff regarding that. So we found from the field that some spiritual healer do their job, yeah, like this one, this man opening the residential care with Islamic charity, yeah, zakat, infak, and etc. And in this care, no professional mental health nurse or something or doctor that working there. So everyone take care each other, yeah. So like a family, and they employ Islamic approach in this residential care. And then in Yogyakarta, we found an Islami, so like boarding school, or we call it pesantren, which is having a very good collaboration with mental health or doctor and mental health professional. So kind of blending between Islamic and medical approach, and also the other pesantren or the other boarding school, which is inclusive between the normal student and the student with the condition, the mental illness condition. And also we found a special clinic run by Ustad to do the ru'yah, even though this clinic is not mainly for mental health, but they usually found or receive client with that kind of a problem, psychological problem, and the Ustad do home visit or referring the client to psychologists or psychiatrists, or referring each other. This the case study, and Islam is the largest religion in Indonesia with 87.2% of the Indonesian population identify themselves as Muslim. Indonesia is the largest Muslim population in the world with approximately 207 million, more than that, Muslim in 2010. 2011 survey of 1880 Indonesian Muslims saw that 26% identified themselves as Sunni, none as Shiah, and 56% neither Sunni or Shiah, but just a Muslim. Based on the same survey, 38% said that they use traditional religious leader when they or their family members are ill, although the illness were not specified. Trends of thought within Islam in Indonesia can be broadly categorized to modernism or traditionalism. So what is healing? The culturally meaningful social response. I am undergoing prevention. And medical system are pluralistic structure at different kind of practitioner and institutional norm. We are trying to answer this question. What Islamic concepts have been put to use by Islamic healing practitioners in Indonesia for mental health care? So the differences between the us and the first presentation, maybe we are speaking from the Islamic healer point of view. Yeah, how have this facilitated or challenged collaboration with mental health professional? So this one is our global finding for this topic, that Islamic healer basically can do or can collaborate with mental health professional with this. We are trying to understand what is the Islamic healer. The first one is the characteristic that they are stressing out, highlighted the altruism, purity, and respect patients. They have point of view that patient is actually pure because of their illness, and also the cause of illness from their point of view is the illness is because of jinn or psychological state, or both. Yeah, or both. And the methods that they use is Quran, ritual, habitual, identity, safaat, and meaning making. And for the Quran, it is very much depend on the purity of the Islamic healer. So Quran is like a knife. If it is on the hand of the child, they can cut the tree, something like that. Yeah. So that's what they say. So so the one who do ru'yah or Quran recitation should be some very pure. And from perspective mental health professional, they have a characteristic from tolerating or facilitating or even endorsing, and usually they are spiritual themselves, and they have to have a kind of point of view that the cause of illness is biopsychosocial, and the method that they use is medication and psychotherapy. The supporting condition to make the collaboration running very good is respect each other, respect belief of patients, and then literacy, mental health literacy as well for the healer, and the spirituality of the mental health professional. Then barriers is the medication versus the conscious. Like the healer said that when the patient on medication, they can't do the zikir properly, something like that. Yeah, so usually there is a negotiation between a mental health professional and the healer, like maybe when there is time for doing the ru'yah with Quran, then they alter the time for consume the medication, something like that. And sometimes the family belief also become a barrier of that collaboration. Then my co-author, my colleague Ade Prastyani will discuss more about the finding, please.
Thank you very much, Ibu Diana, and thank you very much to all the organizers. And considering the interest of time, and also thank you, Ibu Diana, for presenting already the global finding. I think we are going to skip some of the things that have been mentioned by Ibu Diana, and we'll focus on several findings that probably will be interesting for the purpose of our discussion today. So the first one is the finding that Islamic healers have explanatory models about illnesses and recovery. And the first one is the most converging finding, where the experiences and symptoms of in mental health, such as delusions, hallucinations, and obsessive thoughts, have been attributed to the influence of jinn or the devil. And this is also in accordance with the finding of the previous presentation, in which in Islamic healing, and also in the patients with mental illnesses, the premises or concepts held true in the tenets of Islamic religion have always been used as the background against which mental illness has been defined, and this influence of the jinn in delusions and basically unwelcomed behavioral and thought contents and patterns have been attributed to the jinn or the devil. Slide, Ibu Diana. Yes. However, what is interesting is the entanglement of this understanding of faith, of jinn influence or disorder, disturbances, and the framework of two bodily organs, which is the heart and the brain. And in this data that is presented, this patient with living with schizophrenia was presenting firstly with the symptom of heart palpitation, and she's a person living with schizophrenia. And the doctor, upon examination, could not find anything physiologically diagnosable from her palpitation complaints. And instead, this doctor advised her to seek alternative spiritual healing. This really shows how there's a prevailing understanding in Indonesian Islamic society that it's not rare for spiritual disturbances to be associated with the organic illnesses of the heart. And this is also common to consider spiritual disturbance of the heart to manifest in the form of emotional and psychological problems. Slide. Ibu Diana. Okay, thank you. And therefore, it's surprising finding that one of our Islamic healing practitioner declared an alternative explanatory model that an illness of bad thoughts are the result of the malfunction of the brain instead of the heart, with a strong statement that he said, the human hearts never get sick, only the brains get sick. So in a glance, it seems to be there's a synchronicity in terms of explanatory model of illness with that of biomedicine or psychiatry. But then we start to ask ourselves, could this be an entry point to the application of biomedical epistemology in mental health in Islamic with the Islamic healers? And it turns out it's not immediately so, because slide. We also found after that slide, Ibu Diana, that in this Ustad's explanatory model, the brain's illness is not seen as merely organic or physical in nature, but rather still that of supernatural or spiritual in nature. And in his understanding, the connection of the heart where faith resides and the brain where thoughts occur were a vulnerable point of entry for jinn or satanic disturbance. This shows that the composition or functional concept of the brain and the heart in the Islamic healing practitioner informants that we encountered are different to that of anatomical physiological concept of these organs. Slide, Ibu Diana. And nevertheless, this identification of the brain as the organic side of mental illness has also been followed by a logic that a cure exists that would affect the brain and therefore alleviate a person with of their emotional distress or thought problems. And in this case, one informant even mentioned the usefulness of pomegranate. And the mention of pomegranate have been found in 3 verses of the Quran. And this has attracted attention to several ethnomedical scholars in Islamic healing. The notion that pomegranate is a representation of fruits that could be found in the Garden of Heaven has inspired many to seek its therapeutic potency. However, we have not found literature that would present its usefulness in mental health other than this one conveyed by one of our informants. And slide. Whereas, slide, Ibu Diana. Apart from the explanatory models of the jinn, as well as the these mention of the heart and the brain, there are 2 also explanatory causes of illnesses that were mentioned by our informants. The first one is the psychological origin of illness, which is tulul amal, or unmet, unrealistic life expectation. That is also reiterated by the previous informant, and this is all different though than the impact of the heart-brain nexus vulnerability to jinn disturbance, and this is mentioned as a standalone causal factor, not explained in the same metaphysical logic. Slide, Ibu Diana. And the second one is the social-economic origin of illness, where socioeconomic factors, disparity, impoverishment has been also attributed as the causal factor of mental health problems. And this, in the his logic of the Islamic concepts of impoverishment, how it impacts the degradation of a person's faith, which will lead to mental health problems. Slide, Ibu Diana. So there are several modalities of Islamic healing that we found, but I think we are going to skip some of them for the interest of time. And the first one will be rituals and daily routine, Slide Budiana. And this provides a structure in the daily life of the patients. Second one is also habituation in the forms of rehabilitation of Islamic etiquette and or manners. This as a example is in their eating habit, Slide Budiana. And then ruqyah. Ruqyah is simply defined by one of our formats as reading the Quran with a proper tartil, with faith, with a strong faith, and also this, most importantly, with the intention to plea for healing. And this is also, you can see at the back there, bottles of mineral waters, where it is used as sort of a physical medium, which would assist the healing power of the Quranic reading. And how does this Quranic reading work? The first one is used as a weapon, so to speak, to battle the jinn, and as a weaponry to battle the jinn. And this interpretation may also be explained by historical contextualization of the pre-Islamic concepts of traditional healing, where direct human and supernatural beings have antagonistic interaction, ranges from negotiation, appeasement through sacrifices, as well as confrontation. Lady Budiana. And the second one is the mechanism of work of therapeutic value of Quranic reading as having a calming effect. This is a physical and effective sensation reported by one of our female informants with schizophrenia. And zikir is also important in the way that it is a venue to remind someone of the cosmic nature of a human being the mortal creation of God, and with the expectation of full awareness towards their thoughts and actions and behaviors. And this is also intertwined with the explanatory model of the heart, where zikr is associated with strengthening of the heart. And then there's also the use of salawat, which is the practice of praising Prophet Muhammad, peace be upon him, whom is valued as shafa'ah, or the mediator. And literature has pointed out that this practice is more prevalent in the Sufistic interpretation and practice of Islam, which may find an opposition in the Salafi interpretation, in which such practice is considered as a form of polytheism. However, this is a form of practice that is held true in many Islamic communities in Indonesia. Slide, Ibu Diana.
I'm sorry to interrupt. We're running a little short on time, so we're gonna go to the next presentation.
Okay.
Maybe you can come back to this when we start our discussion and Q&A.
Okay, of course, definitely. Shall we go immediately to the conclusion then?
Yeah, if you want to just wrap it up then.
Yes. In that case, I hand it over to a friend of mine that will read up on the conclusion. Thank you. Wulan?
Yep, thank you very much, Ade. So from the findings and discussion, we can conclude it at least 4 points. The first is that the cases that we study in Indonesia demonstrate the diversity of participant healers who involved various forms of collaboration and relationship with mental health professionals. For instance, we have Fadlan with his care as his studying method and his collaborative relationship with a psychiatrist, or others that should have been mentioned. And next conclusion, in the personal relationship between the Islamic healers and mental health professionals are key to maintain a healthy power dynamic between the two different epistemologies. The third is the sensitivity of mental health professionals to communities' cultural, spiritual norms pertaining to Islamic healing, as well as self-reflection of their own spirituality are useful for patients or clients' treatment. And the last conclusion is that there are several concepts used in Islamic healing, such as Quran as Ashifa, Salawat, Shafa'ah, meaning making, etc. Those concepts are useful for mental health professionals' exploration of unmet needs in patients or clients' spiritual dimension. And they are also useful for establishing open dialogue and collaboration with Islamic healers. I think that's all for our presentation today. Actually, we still have many more things we found from our study that we want to talk about, but unfortunately we have time constraint, so we have to end here. Thank you very much once again for the organizer, and thank you the attendees for listening.
Okay, thank you for that presentation. Next, we have a presentation on exploring spirituality, integrated psychotherapy for addressing Muslim mental health within Islamic context by Fahad Khan, who's a Deputy Director at Khalil Center.
Jazakallah khair. Assalamu alaikum wa rahmatullahi wa barakatuh. Bismillah ar-Rahman ar-Rahim. Alhamdulillah wa salatu wa salamu ala rasulillah wa ala alihi wa sahbihi wa man. So you already know the title of my presentation. I'll skip inshallah to the other slides. So just to give the background, I think a lot of you are already aware of this research, so I'm not going to go over the detail. I think we are already aware that there's Muslims are not very active in seeking help when it comes to psychological illnesses. There's some literature here citing some of their help-seeking behaviors. I do want to talk a little bit about spiritual integrated psychotherapy. There isn't much research on it, but some of the research that does exist indicates that spiritually integrated therapies are at least as effective in reducing depression and anxiety than traditional non-religious therapy for religious clients. When compared to religiously integrated CBT versus non-religiously integrated CBT, the religious integrated CBT was as effective in reducing symptoms of depression. So this is just to kind of set the stage for what we did in this big study. So again, I'm just gonna skip over this part here because of shortage of time here. And there's very few outcome studies when it comes to looking at spiritually integrated or Islamically integrated, especially studies looking at the framework. The paper published in Journal of Muslim Mental Health by myself, Dr. Amber Huck, and others, we looked at this theme of underrepresentation of Islamic frameworks. And that's an area that unfortunately we need to work on, is not only developing Islamic frameworks, but also conducting research that looks at outcome of these frameworks so that they can be made more practical and applicable. So Khalil Center in the recent past was part of a multi-site study, which was led by the Bridges Consortium. And we asked the following questions, basically. What types of spiritual approaches and interventions do mental health professionals use in their practices during the course of treatment? When and how do mental health professionals use the spiritual approaches and interventions during this treatment? And how effective are the spiritual approaches and interventions with different type of clinical issues and patients? Now, in this big data study, it included 22 centers. So this consisted of Christian, Jewish. There was another Muslim center that applied Sufi psychological practices. I don't know how big of a data that they collected, but from what it seemed like, it wasn't as big of a site as Khalil Center was. Overall, they recruited 30,000 clients. The primary aim was to have a large data set to demonstrate empirical support for spiritually integrated psychotherapy. Research aims for our study was to assess the effects of Islamically integrated psychotherapy on distress, both psychological and functional distress. And secondary, we wanted to also look at religiosity, experiential religiosity, as well as positive religious coping. We also wanted to explore patient characteristics such as demographics, their religiosity, comorbidities, experience with mental health that may mediate the effect of Islamically integrated psychotherapy on distress. And we wanted to identify any specific Islamic spiritual techniques that positively affect outcomes. The research questions we asked was, does Islamically integrated psychotherapies increase experiential religiosity and religious coping? Does Islamically integrated psychotherapy approach decrease psychological and functional distress? And are there any specific Islamically, spiritually oriented interventions that show promising results for reducing psychological and functional distress? So with that in mind, our primary hypothesis, the first hypothesis was usage of, so let me just skip over actually, because I didn't introduce our, should have probably had that here, sorry, instruments. So the instruments that we used, we had the CAMUS, which was the clinically adaptive multidimensional outcome survey. This measured distress, psychological, relationships, spiritual, physical health, and work, school. So we're looking at functional distress and therapy expectations. This is something that the clients completed. It could be beginning of the session or at the end of the session. The second one was Core 10, which is the clinical outcomes routine evaluations, 10 questions that looks at psychological distress. So generally depression, anxiety, and some functional distress as well, trauma and risk. From the therapist side, the therapist had to complete the therapist session checklist, which looked at topics discussed, therapeutic interventions, as well as intentions and other things. And then the clients also, Khalil Center added on Muslim experiential religiousness and psychological, from the psychological measure of Islamic religiousness, we chose the positive religious coping subscale. So going back to the hypothesis, we wanted to see usage of Islamically integrated psychotherapy will be positively correlated with experiential religiosity as measured by Muslim experiential religiousness scale and religious coping as measured by the subscale from the PMIR. The second hypothesis was the experiential religiosity will mediate the effects of Islamically integrated psychotherapy by decreasing functional distress as measured by CAMUS and psychological distress as measured by Core 10. The third hypothesis, Islamic positive religious coping will mediate the effects of Islamically integrated psychotherapy with overall functional distress and psychological distress, and the use of Islamically integrated psychotherapy will reduce psychological and functional distress as measured by Core 10 and CAMUS. So, just to, I will kind of glance over this part a little bit. This is what would be considered like a practice-based evidence, and they're different from the traditional randomized controlled trials methodology. But in some ways, you can say they're complementary. One of the main differences is that practice-based evidence designs focus on collecting data in a naturalistic settings that increases its generalizability, which is a limitation of the randomized controlled trials. Therapists continue their treatment as usual. They're not asked to use a treatment manual. This is something that we obviously even don't like to use at the Khalil Center because our model itself isn't, reductionistic in its form. So all patients presenting for treatment are included in the study, which does create heterogeneity with regard to personal characteristics as well as presenting problems. Allows for quicker data collection, general applicability of findings. The practitioners and site managers have the primary ownership of the data as compared to RCTs. And then, so this was that kind of approach. In our team, both Dr. Carrie, who's our discussant for today, and myself, we were the co-PIs. And as part of our core team members, we had Dr. Human Kashavarzi and Maulana Bilal. Maulana Bilal served because they required a scholar to be also part of the team. So he was the scholar who was part of the team, and Dr. Human was the other clinician. And we had a total of 5 clinicians. So we had Dr. Human and myself as the 2 male clinicians, and we had 3 female clinicians from the Khalil Center team that we recruited. And our aim was to have 250 clients and 800 therapy sessions, and the instruments that we talked about already. So I'm not going to go over the TIP model of care because of lack of time. And if you'd like, you can look that up. We have some presentations on that already and publications on that. But this is kind of like what the TIP model looks like. It's a comprehensive model. It's, we've been developing this for many years now. So this is what it looks like in its current form. We look at human ontology from a holistic perspective, looking at it from the perspective of aql, ruh, ihsas, and nafs. So again, we don't use a reductionistic approach. It's an integrative model that draws from several approaches that are currently used in contemporary psychology. This is the process of change from the patient side as well as the practitioner's side, the mechanisms that are used. And again, health and pathology is observed on the range rather than the presence and absence of clinical illness. So some of the data I want to present that as well in the last 6 minutes. We had a total of 107 clients. Now from the client side, we had about 449 surveys. From the therapist side, we had about 420 surveys. From the total clients, we had 64% male, 31% females. And the ethnicities are as follows here. You can see 94.7% identified themselves as Muslims, 93% Sunnis, and you can see some other demographics here. Question, is religion, spirituality important in your life? 94.7%. Most of the people who come to Khalil Center would answer yes to that anyway. And then, do you wish to discuss religious, spiritual issues in counseling when relevant? You had 93% that said yes. Do you wish to try religious, spiritual suggestions from your counselor? 92.9% said yes. Some of the data I'm going to present and show here today. So from the therapist side, first I'm going to talk about that data. This is the TSC's, the therapist session checklist. So the therapist was asked, in the beginning of, or at the end of every session, like during the session, which theoretical orientation did you mostly adhere to? Just before you look at the data, the Islamically integrated psychotherapy and the Islamically integrated is actually one, and the spiritually integrated and the spiritual theistic is actually one. So these two numbers should be together. So technically, Islamically integrated and Islamically integrated psychotherapy is the highest one, but the way the chart came out, there's an issue, and I didn't want to change the numbers, so I presented it as such. But after Islamically integrated, you have cognitive behavior. So there was an option of checking more than one because, again, this wasn't a manualized approach. It happened naturally in the setting. So for example, at the Khalil Center, it's an integrative approach. So, if somebody comes to the session, you may have a CBT-oriented approach where you may begin from a generalized CBT approach, but might go specifically into like a third wave acceptance commitment therapy approach, which is completely fine. There's no strictness as to you have to stay within a general CBT or stay within the acceptance commitment only approach. You might start with CBT and you might shift into an emotion focused approach, and that's completely fine as well. And you might have a session which is Islamically integrated. You might have one that is not Islamically integrated at all, or you might have one that's completely Islamically integrated and doesn't utilize anything from like CBT or any of the other approaches, and that's also completely fine. Some of the counseling topics are listed here. Some of these are not showing up for some reason, but you can see some of the ones that were utilized more frequently. These were intentions listed by the therapists. These are the spiritual interventions that were used by the therapist. Some of these were already present in the therapist session checklist given to us by the consortium, and others were added on by us at the Khalil Center. Like, for example, Mujahada, Husn al-Dhan, Musharata, etc. And then within, once you accepted which type of theoretical orientation you chose, you were further asked to identify specifics from that. So if you chose acceptance and commitment therapy, you were asked which specific intervention did you use from that therapy. So encouraging acceptance, for example, or developing cognitive diffusion skills, etc. So these are specifics from each of those. So we have that data in here as well. This is just some bivariate analysis that we did, looking at some changes. I'm still working on the data, by the way. We don't have the especially data from comparing if you connect the data between the outcome of the intervention used and how that changed what happened with the client. So that data is still being worked on, but individually speaking, here's what was happening with the client side. So you can see there was a dropout. Some people didn't need therapy. Some of them weren't filling out the forms. They are voluntary at the end of the day. So after some sessions, there was a dropout. Now, with the symptoms, there was a decrease in symptoms up to session 6. With core 10, these are psychological symptoms. And then you look at functional distress with CAMOS, there was a decrease. There was an increase up to session 6 with experiential religiousness and with the coping as well. So what we're doing now, we just submitted a chapter in an APA book, which is being authored by the individual who actually started the Big Data Project, Dr. Scott Richards. And so we just submitted a chapter in that. There's an article in the works right now for a special edition of one of the journals as well. So we do plan on having more articles out in some of the journals. And then we do want to further analyze the data and see what else we can publish from that. And obviously we need more studies. So this is just the beginning. And the more studies that we can get out there, the more we can present the efficacy and the outcome of Islamically integrated psychotherapy, especially our model, which is the TIIP model at the Khalil Center. So with that, inshallah, I will end my presentation. Jazakallah khair.
Okay, now we can go into discussion and Q&A with Carrie York Al-Karam.
Alaikum, everyone. Mashallah, that was a great panel of presentations. I think that nicely sort of highlight some of the various ways that Islamic psychology is conceptualized, some of the different types of work and fields of inquiry that people are engaged in when they think about Islamic psychology. I think also that this demonstrates quite well sort of the growth that the field has experienced over at least the last number, 4, 5, 6, 7 years. Even if you look at, last year, the Muslim Mental Health Conference had an entire track on Islamic psychology, right? That was done in collaboration with Khalil Center and also the International Association of Islamic Psychology. And then, to sort of springboard off of that to continue to have more presentations on Islamic psychology, I just, think that is testament to the, the interest in the field and the fact that the field is actually growing. And I think, with the presentations that we've had today, again, you can start to see some of the development and sophistication that the field is taking from, if you sort of look back at some of the earlier calls for Islamic psychology, where it was really more that, right? Like a call for exploring and developing Islamic frameworks, to actually now doing that, right? With some scientific and some methodological rigor. So I think that, that's, one of the takeaways from the presentations that we have today. In terms of moving forward, I don't want to spend too much time going on. I would really like to give the audience an opportunity to ask questions. But so in addition to what I've just said, I would also like those who are on the call today to also just think about, sort of where Islamic psychology is going and sort of potential future. And one of the things that I have always sort of argued is that, and I write about it in a couple of one paper that I just had come out, and then another one about Islamic psychology in the United States. Actually, maybe it's a good chance to mention that. So the International Association of Islamic Psychology and this actually ties together with what I was just saying about the growth and sophistication of the field. The International Association of Islamic Psychology has a book coming out later this year called Islamic Psychology Around the Globe. And that is co-edited by Amber Huck and Abdullah Rahman. And there are chapters from various countries around the world that talk about the Islamic psychology scene in those particular countries. And I was asked to write the chapter on Islamic psychology in the United States. And so, you know, I think, again, tying to what I had just said, you're going to start to see, you know, development and more sophistication in these various areas in the various countries. And so for those of you interested in that, in this field specifically, you know, look for that publication, because I think, you know, it'll be really interesting to see how things are developing in various places. But as it relates to the United States, I mean, because obviously every country has its own context within which the field is developing, and it has its own unique challenges and its own unique things that it has to address. But as it relates to Islamic psychology in the United States and looking sort of towards an Islamic psychology of the future, I think we really need to think about how we can expand the field. So the wonderful presentations today mostly focused on aspects of Muslim mental health. Makes sense, right? This is the annual Muslim Mental Health Conference. And one of the things that I have, you know, have argued before is that, of course, Muslim mental health, at least in the United States, and you could argue other countries as well, is one of the contexts that has given rise to the field of Islamic psychology, right? Looking for frameworks of psychology that are applicable to Muslims. But I would also say that, you know, for especially those of us in a Western non-Muslim context, we not only need to think about how to expand Islamic psychology to other fields of psychology, right? Not just mental health, but social psychology, educational psychology, industrial organizational psychology, but also how Muslim thought and Islamic psychology might have relevance to everyone and not just Muslims. Otherwise, we're just kind of relegated to some niche field about dealing with the mental health needs of Muslims. Although that's very, very important. It's very important to address the mental health needs of Muslims. But in my view, Islamic psychology is way bigger than that. And so I would encourage, you know, those of you out there in cyberspace to think about the various ways that we might do that. You know, here in the United States, whether it's the APA or our psychology colleagues, you know, diversity and inclusion are the buzzwords of the day, and people do want to hear Muslim perspectives or Islamic perspectives. So that call is there, and Muslims are, you know, are contributing. And so, you know, moving forward, I guess those would be, for me, the sort of the two takeaways is how can we expand the field beyond the clinic. Actually, that was the article that I published, I believe last year. It was this Islamic psychology expanding beyond the clinic. How can we expand the field beyond just these clinical mental health domains into other areas of psychology? And what relevance does Islamic psychology have within a non-Muslim Western context? Those would be the two things that I guess I would leave the audience with to sort of think about moving forward. So I'll end it there, and I think that'll give us about 20 minutes for questions. So I guess I'll just turn it back over to you, and we're here. Kudos to Fahad. I'm so glad, you know, that he mentioned about other publications. Yes, we've got to get our act together and put this together in a published journal so that we can share the data with you, so that it can be of benefit to you, and hopefully you can build other studies from that. So thank you to my colleague Fahad for that. So I guess it's open to questions. Back to the organizers.
Yeah, so if anyone has any questions, they can either send them on the Zoom chat or the Wovo app. Or if any of the panelists have questions for each other, maybe.
Can participants simply unmute themselves?
Hi there, Assalamu alaikum. I was wondering if it was possible to access the PowerPoint presentation, specifically the first presentation from Mr. Cinisli.
Furkan. It is better to Furkan.
Oh, sorry. Furkan, sorry. I don't know why I wrote your name down from the website. Sorry. Yeah, I was wondering if it was possible to access your PowerPoint presentation because you went through it kind of fast, and I kind of wanted to get back over some of the material, especially. Yeah, there's just a couple slides that I was really interested in. So.
Okay, I can share with the panelist or who is the responsible for it, and they can reach you. Also, I can send to you if you write an email or the chat box. I can send.
Okay. Okay. Thank you.
Assalamu alaikum. Can you hear me?
Yes.
Thank you. Thank you to all the presenters. Barakallahu feekum. My question kind of follows what Dr. Al-Karam was discussing earlier. All three of the presenters come from completely different cultural, geographic contexts. And here in North America, we obviously have been having some really historical discussions on cross-cultural competency. And the Islamic perspective on cross-cultural psychology is obviously something that might be of benefit, not just here in North America, but across the world. So I was wondering if the presenters could comment on how you see Islamic psychology contributing to the wider context of cross-cultural psychology. Barakallahu feekum. Thank you.
Fahad, you want to respond to that?
Sure. So, I mean, I can share my perspective, and I think that some of us can disagree as well. I have, there's two things I want to mention. One is that I think that Islamic psychology, as it exists right now, I think it is in the modern day is in its infancy, because unfortunately, like in the past kind of several hundred years, we kind of lagged, and we need to catch up a little bit. And so I think that because of that, we have to do a lot of work internally first before we start thinking of how we can generalize it, or how we can present it or represent it to the wider audience. And until we have a stronger base, it'll be challenging. But there are still ways to make it applicable. I mean, we've had clients at the Khalil Center. I've had several clients who've come for several reasons. Like, for example, we've had clients who came just because our model at the Khalil Center, based on Islamic principle, that we don't turn anybody away. To give an example, if you didn't get a chance, you should read the book Islamic. It's on forensic psychiatry by Dr. Chalabi. It's published by IIIT. And there he talks about that, as Muslims, if we know somebody is in need, and that you can help them, it is no longer an option for us. It becomes an obligation, right? So at the Khalil Center, we have a policy of service over fees. So if I know that somebody needs psychological service, whether or not they can pay, we have to help them. And given that, we've had several non-Muslims come to us knowing that we offer affordable care, and they've come through the door knowing that it's an Islamic institute. You have to take off your shoes. There's calligraphy on the wall. When it's time to pray, we pray. Our front desk administrator wears a niqab, right? But they came because it was affordable, and that's based on the Islamic principle. I've had clients who've come and said, short of trying to convert me, which obviously we wouldn't do that anyway, but those were his words, because he kind of wanted to just get his fear out. Help me through the Islamic principles as much as you can. He asked me to even said, can you pray in front of me? I want to just know how it feels to sit next to someone who's praying the Muslim way. So I said, that's fine. If that's what you're asking, I'll do that for you. So, but I want to make sure that we have a stronger foundation. The other thing that worries me is and part of the reason why we are so adamant about even the name of traditional Islamically integrated psychotherapy is that although of course in Islam there's a lot of variance and diversity that exists, and when it comes to knowledge, there's qat'i knowledge, which is definitive knowledge, that which comes from the Quran and Sunnah, which we can't change, it's there. But then there's a lot in the field of psychology that is probabilistic knowledge. This you and I can agree on. Is nafs and ruh the same? We can disagree on it, and that's perfectly fine. But from that probabilistic knowledge, we can have that discussion. But I want to make sure that we are very cognizant that we don't dilute the core tenets of Islam, because I think in what has happened to like Buddhism, for example, or even Hinduism, and that's not of my concern, but what concerns me is that what has happened to them while they're trying to merge into psychology is that the religion itself has become diluted. And I want to make sure that my deen and my religion, just for the sake of making it more presentable for non-Muslims, that it doesn't become diluted. And that's just my concern. Again, you can disagree with me, and I will respect you with that disagreement as well, inshallah.
Am I supposed to be moderating, or I'm not sure if there's anyone else there. I would mention that, there's a lot of complex issues that arise, mashallah, beautiful response from Fahad. But it's like, even in that response, it highlights so many other issues. There's so many, kernels of things that you said that we could then, spend a whole afternoon talking. And I know you're aware of all of those things. So there's a lot of complex discussions to be had, especially as we talk about, the development of Islamic psychology in a Western non-Muslim context. But that's not, there's also a whole complexity around the development of Islamic psychology in Muslim majority contexts as well. I lived in the Emirates for 10 years, and it's like, Islamic psychology, we don't want any of that. So there's a whole other backdrop and a whole other, issues that come along with that. So
there's a question in the chat box by Nur. She asked, or sorry, maybe it's he, but they asked about how many sessions does it take at the Khalil Center for meaningful change to observe? That obviously that varies, because we don't have a manualized approach, but on average, it does. On average, our average number of sessions is about 8 to 12. So between 8 to 12 sessions, people do generally feel better. And our data does suggest, we measured it we used to use BSI, brief symptom inventory, and the change was statistically significant over 8 to 12 sessions. Now we're using PHQ-9 and GAD-7 to measure psychological symptoms.
for those of you interested, I just want to mention this before I forget, for, obviously those that are attending, you're interested in Islamic psychology. We will be having a conference. The Al-Karam Institute will host a conference. I believe the title is Islamic Psychology, Advancing the Field. And that will be held this fall at George Washington University in Washington, DC. So more to come on that. Hopefully we'll be discussing some of these other issues about expanding the field and the complexities around that. So just sort of look for that. I guess we don't have dates yet, but hopefully Fahad will be there as well. Drag him over.
Hello, hi.
Alaikum.
Sorry, Thank you very much. And I just want to provide a response from the Indonesian context about cultural competence and also tying it up with not only what Islamic psychology's contribution is for cross-cultural competency, but also beyond, as you said, beyond the clinic and beyond providing care for Muslim communities. I think the project that we are doing at the moment is specifically designed to target this topic. Indonesia itself is a very diverse society with 270 million people of at least more than 6 recognized organized religions, as well as local indigenous faiths and beliefs. And with the Islamic faith as the dominant population in Indonesia. But the study also wants to look at not only psychology and biomedical intervention, but also traditional and faith-based healing. And so I think in terms of cross-cultural competency, the first foundation to approach this topic is also to understand that we are all coming from our own cultural construct. So in order for us to approach cross-cultural competency is to deconstruct our own cultural construct in order to find practices and notions that we have held true, and see if this is the same that is held true by the clients or patients that we encounter, and also colleagues that we encounter, in order to actually provide clarity in terms of communication, and secondly also to provide a reflexivity in terms of the explanatory models that we have held true in our practices, and looking at the importance of the social context of cultures and economic context as well as the use of terminologies that might not always translate the same thing between the different cultural constructs. And lastly is also the openness to discuss this in a safe space with fellow colleagues, with the patients and clients, as well as with people stakeholders that have also skin in the game in the care of the clients that we encounter. Probably that might be some of the points that we want to raise from the lessons learned from our project. Thank you.
There's another question that was asked in the chat, if you don't mind. So they asked, what does Islamic integration look like with psychodynamic counseling? And what's the best way to train Islamically integrated counselors? So I just want to say, I think generally speaking, if you want to become an Islamically integrated psychologist or Islamic psychologist, the word Islamic is a key word here. So training yourself or educating yourself with Islamic sciences is the key. The reason it's the key is because, like I was mentioning before, if we're not aware of what Islam says, then what's going to happen is as soon as we hear something, we might just adapt it and accept it without recognizing, is this okay from an Islamic perspective or not? Our ancestors, like if you look at what the people were able to do, from between 7th and the 16th or 17th century, they were able to take from the Greek and Hellenistic teachings, and they were able to filter it. And they only probably rejected like 10% of what was there, and they were able to take 90% of it because they had a filter which was given to them by the Prophet ﷺ and the Sahaba and the early generations, and they took that, and once they filtered through whatever was able to go through, they accepted it, and whatever wasn't, they were able to toss that out. So from a psychodynamic perspective, I mean, a lot of what Freud said it's perfectly fine in Islam, but some of it is something that we have to reject, right? We have to reject the psychosexual part that he talks about, because it just doesn't fit well, or the negative tendencies that human beings might. I mean, some of the negative tendencies do, even our model, if you saw the diagram, human beings are born with aggressive and hedonistic tendencies and drives. That's even Muslim philosophers have hypothesized that. One of the things that I want to mention is the aspect of dreams. I mean, people don't often do dream analysis. I think every Muslim psychologist should work on dream analysis in their practice, as Freud did. But this was the Sunnah of Rasulullah to do dream interpretation every day with his Sahaba. In our book, actually, the one that we published last year, this one, we have a chapter which is dedicated just for dreams. So, if you pick up a copy of this, you should be able to read that chapter on dreams and their role in Islamically integrated mental health care practice. So our model actually worked on identifying, on creating that filter, so that once we have that filter, we're able to you can take from CBT, you can take from psychodynamic, but creating that filter requires an individual to have Islamic sciences and Islamic studies. So, all of us, if we wanted to have Islamically integrated approach and become Islamic psychologists, we need to go back and study our deen beyond what we studied in Sunday schools or mandatory education in Islamic countries, or through our primary and secondary education.
Excuse me.
To that, regarding the question about what does Islamically integration look like with the psychodynamic counseling, if you go to our book, which we published a couple of years ago, Islamically Integrated Psychotherapy, which Fahad has that was kind of a precursor. They did a chapter there, and then mashallah, they were able to do a whole book on that. But there are I want to say 9 or 10 different chapters where it talks about how 9 different therapists practice integration. I'm not sure if one of the chapters is on psychodynamic therapy, but I know that there is a chapter on, I want to say, psychoanalysis, the chapter by Paul Kaplik. There's a chapter that's written with one of his co-authors in Germany, who is a psychiatrist. But aside from psychodynamic counseling, if you want to see, that book kind of provides a view as to how different practitioners practice Islamically integrated psychotherapy with various approaches, to just sort of piggyback on that and give you like a smorgasbord of different ways people are doing that. That's helpful. Regarding the question about getting training during residency, you probably won't get anything in residency. Thank you. Are there any of the? Was there someone else had turned off their mic and started to ask a question?
I'm sorry, yes, I did. Oh, I wondered if Fahad could put the name of that book up again, Applying, and that's all I got. Sorry.
You're muted, Fahad, just in case you didn't know.
Oh, sure, here. And I think we're done with our time, by the way. Just want to make sure.
Thank you.
There is a break until the next session at 10:45. So if there are more questions, you can go ahead and ask them.
I have one question, if that's fine, to Dr. Fahad. So he mentioned that the first thing about the Islamic therapy is the word Islamic. So you need to study Islam first. But isn't it that make non-Muslim psychologists or therapists, it makes it harder for them to provide Islamic integrated therapy for Muslims? So if we provide like a framework or diagram for non-Muslim psychologists or therapists, that would be fine for them to help Muslims. But if we ask them to study Islam, that would make it harder for them, if I understood it right. So could you explain a bit more about that?
Yeah, so I guess my assumption then would be that the person who is trying to become an Islamic psychologist, I mean, I'm not saying you have to be Muslim. I'm saying you would have to like there are a lot of non-Muslims who teach Islamic studies and who have PhDs in Islamic studies, right? So I think that I don't think you have to be a Muslim to study the Islamic sciences or Islamic studies. But I think in order to understand, because, you know, like the reason I'm saying that is the underlying assumptions of like at least our model, the traditional Islamically integrated psychotherapy model, you know, there are a few underlying assumptions. Like one of them, for example, is like looking at how a human being is. You know, is a human being created in you know, from a positive essence or from a negative essence? And then on top of that, our existence and our development doesn't start with birth and end with death. There's a primordial essence. What is that primordial essence? Like, what are we talking about when I say primordial essence? You know, in the Quran, it talks about how every one of us were gathered together and asked a question, Alastu bi rabbikum? You know, we have a covenant with our Lord. What does that covenant mean in terms of how we are in this world? When I have an anxiety, when I do something bad and wrong, and I have this anxiety, this existential anxiety inside of me, how does that relate to my primordial covenant that I have with my Creator? Do you see what I'm trying to say? Like, in order to understand that, there's going to be some context that exists there. You know, if somebody hasn't really read the verse and understood it or internalized it, it's going to be a little bit challenging. I'm not saying it's impossible. It's going to be a little bit challenging for someone else or someone who doesn't know the context behind it. Now, in our book, we do suggest the basics. So we say, like, if you don't have the time to go back and study, you know, and I can just jump to that chapter and show you the recommendations that we give. So we say you can study the most basics, which is like the basics of Arabic studies and Islamic studies. But I think at the end of the day, what I was trying to say is, especially for Muslims who want to be Islamic, because if you want to be an Islamic psychologist, the part Islam is crucial, and I think that's the part that we can't miss out on, because you know, that's the most Islamic part of this, or this whole terminology, Islamic psychology. So we talk about here like proficiency in Arabic, prerequisite introductory courses, Islamic studies like Quran, Hadith, Islamic law, Islamic theology. And then we do give like even specifics, like studying Mukhtasar al-Quduri or its equivalent, you know, Aqidat al-Hawiyya, et cetera, et cetera. So I think this kind of will give you some foundational things. And again, we say it's equivalent because you can study something else depending on, you know, which madhab, or you can even be a Shia, or I suppose, and study from that perspective. But this is just, again, from our understanding of it. Does that answer the question? Sorry.
This also brings up the
Thank you.
element here, and what's so challenging is what makes something Islamic. It's how we answer that question, because there are scholars out there that says, just because something doesn't have to be labeled Islamic in order, anything could be Islamic, right? It doesn't necessarily have to have that Arabic word or, you know, sort of attached to it. I mean, there are modern day Islamic scholars who write books on that, like what makes something Islamic, right? So you could say that probably 80% of psychology today is Islamic, right? It's not in contradiction. And sort of going back to what Fahad was talking about, how the classical Muslim scholars, you know, their process of filtering, you know, they were able to filter what came from the Greeks and that sort of thing. Well, that's what Muslim psychologists are doing today. People are filtering, right? But again, it comes back to that critical word of what makes something Islamic. Does it necessarily have to be something that's visually or visibly, you know, has the Arabic words and Islamic Quran, or is it a concept or philosophy whose essence is essentially Islamic, but might not be explicitly outwardly so, but inwardly so it is?
I think that the difference, and again, it's not how it appears, it's what's happening on the inside too, right? So for like one of the things people are doing now, and I linked in here, somebody asked, like, what do you recommend for non-Muslim clinicians? You know, there's like the the RCBT manuals that exist for Christian Jewish. And that's a good example of what they've done with like just sprinkling Islam on something and calling it Islamic, right? So, you can change something to Arabic. You can use, Google Translate and change it to Arabic and call it Islamic. And instead of using like Jewish verses, change it to Islamic, find in Quran any verses that talk about hope, throw them in there and then call it Islamic. But that's not what I mean when I say Islamic. I'm saying like underlying assumptions of what is health and pathology, underlying assumptions of, what are the importance of dreams? What are the importance of, what is the place of human being in this world? When I'm working with a client, like I'll give you one clinical example. I had a client who came to me who previously had a therapist, and he wasn't happy with the therapist because when he went to this therapist and he wasn't happy in his marriage, and he was, thinking about cheating on his wife, his therapist didn't say anything because his therapist said or heard the thought process in the therapist's mind was, this person isn't happy with his wife and he needs to do what makes him happy. So if he wants to go out and have an affair, then that's his prerogative. It's an individualistic society we live in. So, she didn't stop him from cheating. But as a Muslim, like I'm not thinking from just this worldly perspective. As a Muslim in Islamic psychology, not just like I said, sprinkling Islam on top of it, Islamic psychology tells me that I need to think of the hereafter as well. So the context is not just within this world. So I'm thinking of this in clients like akhirah as well in mind when I'm thinking of his treatment plan. So, my job would be there to challenge him and say, this is a big decision this is a big thing that you're thinking about. Are you sure you want to do this, right? That's one example. Another example would be like in the book, we talk about the therapist's internal issues and problems as well as the clients. Like in the mainstream psychology, now there's a little bit of that happening is where they will say the therapist should also go to therapy just to experience it. But they don't talk about like, if I go to my client and tell them, hey, you need to struggle with your challenges and accept what's happening in your life, does the therapist also do that? No, I mean, it's rare, right? They even talk about like how to fake some of these things in sessions, like fake empathy, just for the sake of helping the client. But what about like your own self? So as a Muslim psychologist, as an Islamic psychologist, I can't just preach something that I don't practice. I have to practice that as myself as well. If I'm telling my client, you need to work on your nafs, I need to work on my nafs too. You see what I'm saying? So these are fundamental core things. So this isn't just like, like I said, changing the terminology or just Islamicizing modern psychology. I'm talking about at the core values of what exists in the Islamic tradition. I think there are two different approaches, and we talk about in your book, I think, Carrie, and as well as the 2016 paper that was published with Dr. Ambrahak.
I think we should probably wrap things up just because I think the session was supposed to end at 10:30 and I've got to jump off. So are we good?
Thank you to all the presenters. Yes, you were great. Thanks everyone for coming, and thank you to the presenters. And yes, the next session will start at 10:45, and that's on music and mental health. We hope you can join us. Bye now.
Thank you very much, everyone.